Dedicated to helping you in our series, A Sick System, the Cost of Your Health.
Have you ever tried to dispute a medical bill? It can be extremely difficult, as a Boynton Beach man learned.
After 17 months of fighting, he reached out to Contact 5's Wanda Moore, and now his bill is zero.
It's quite lengthy.
Imagine getting a bill.
It continued to come saying that I was totally in charge.
A bill you know you're not responsible for.
I kept resubmitting to my insurance company. It would never get resolved.
But nobody's listening to you.
They kept pointing fingers at each other, and in the meantime, I kept getting past due bills.
That is what happened to Ken Scherer. It all started in January of last year when Scherer underwent surgery. Among the many bills, one of them stood out.
What was your first reaction when you got that bill?
That I knew right away that I wasn't responsible for 100%.
The bill didn't come from his insurance company like the rest, but directly from the provider saying he owed $2,250.
So something that you don't even really remember what it's for?
No, I have no idea what they did.
And the bill didn't explain what the charge was for either.
It just has a date, a patient's name, and the amount. It doesn't give any description of service rendered.
Scherer figured it must have been a billing mistake.
I don't know how much clearer I could have been with what the problem was, but it still wasn't getting resolved.
He kept disputing it with both the provider and the insurance company.
A lot of paperwork, a lot of emails, a lot of phone calls.
This continued for 17 months, and then it went to the collection agency.
I wasn't going to pay it, even though I always pay my bills, but this was just wrong.
Scherer reached out to Contact 5. We called the insurance company, and the very next day,
I got a call from someone in the executive department, and they told me that they had paid the bill in full. There was a misunderstanding.
the insurance company said in a statement, quote, "It was initially unclear whether Medicare or Cigna was the plan that would pay first. Customer service has now spoken with Mr. Scherer and resolved his claim within 24 hours. Scherer said he learned one clear lesson.
Don't pay the bill until you look at your insurance statements and make sure that insurance had paid their portion.
A few things to remember as you make your way through this maze of medical billing. Know your insurance plan, what it covers, how high your deductible is, and if the doctor you are seeing is in network. When you get a bill directly from a provider, take a hard look at it because you could be wrongfully charged. I'm Wanda Moore, WPTV News Channel 5.
Wanda, thank you. And if you have a medical bill you'd like Wanda to look into, you can send an email to medicalbills@wptv.com, or you can call 561-653-5717. You'll also find this information on WPTV.com.